Newsroom Africa, Channel 405. This is Newsfeed, the AM edition. I'm Andy Ngati. Thanks very much for staying with us. Now, the coronavirus, now categorized by the World Health Organization as a pandemic, is continuing to impact on countries across the world. In South Africa, the number of people who've tested positive for COVID-19 still stands at 13, and this, of course, confirmed by the Health Ministry yesterday. Now, Dr. Zweli Mkhize has assured the country that his ministry is on top of the situation and is doing everything to prevent a further spread of the virus. Now, if an individual contracts the disease, will insurance policies pay out in the event of a death or loss of income? Well, to help us get some of these answers and many other related questions is Marius Botha, who's CEO of Stangen. Marius, thanks very much for your time. Welcome to Newsroom Africa.
Thank you.
I can imagine, of course, this has kind of added all kinds of complexities for how we understand insurance policies, etc., etc. But let's start with the very basic question. I mean, if someone was to, contract the virus and sadly die or have to stay at home, how does that affect their insurance payout if they're covered for those kind of things?
So for a very good life insurance policy, if you acquire the disease and it does result in death, the policy will pay out. For disability covers, it's a lot more complex because it depends on the type of product that you bought.
And I know issues around disclosure are a big thing for insurance policies across the board, whether it's life insurance, etc., etc. If obviously somebody is anticipating that they might be affected by this, what do they need to keep in mind as far as that is concerned?
So I think it is important to note that customers can still apply for life insurance. We will not at this stage decline anyone because of the virus. What is important is honest disclosure in application stage. So it is very important for an individual to disclose any type of symptoms that they have, and then we will take that into account in the risk rating. What is important to note is a lot of people recover after acquiring the disease, and so therefore we are more concerned around what we call comorbidity rates. So it is the combination of coronavirus potentially with other existing diseases, and that is what we need to properly understand at application stage.
And, I mean, do you need to be upfront about where you've been, for instance, even if you're already an existing policy holder? Because already some companies we're seeing are clamping down on employees who are leaving the country for whatever reason, and in some instances actually barring them from coming back to the office to work for obvious reasons. But, do you need to essentially tell your insurance policy that you've been outside the country in this particular context?
In the normal course, we would require customers to disclose how many times they go out of the country on average in any given year. We expect in this instance that there would be less international travel. And so, again, it is just important to disclose to the company how often do you travel. And at this point in time, it would be wise to just keep on disclosing if you're going to continue with international travel, but it should not be of concern to customers to disclose that at this stage.
So yesterday we heard that the WHO has now declared this a pandemic. I do wonder what kind of bearing this has on existing policies, if any.
So with the life insurance, we typically plan over the long term, over the lifetime of an individual's life, and in the normal course we do plan for a epidemic or pandemic type risk. Whilst we don't necessarily have the name of it at pricing stage, we do in the normal course price for it. So in this particular instance, the coronavirus itself does not necessarily worry us from a life insurance perspective. Clearly, if it does escalate into a national crisis, then one may need to relook at the pricing bases. But at this stage, for us, it's business as usual.
And give us a bit more detail about, the ways through which you factor in something like a pandemic or, a global epidemic. I mean, what kind of considerations do you make, and how does that affect customers?
So typically pandemic risks have a very low incidence across the world, and so we rely on specific research from the reinsurance market where they have specialists analyzing the spread of various diseases globally. We use that information at a global level to price for what the probability is of a pandemic emerging, and we take that into account in a pricing basis. In this particular instance, there's still a lot that's unknown about the spreading of the disease. The good signs are that it's got a good recovery rate. Unfortunately, There are a few people that progress to death very quickly. We don't have enough information at this stage, for example, whether it results in other forms of illness or disease. So we haven't seen any form of permanent disability arising as a result of the disease. But in the normal course for death risk, it is priced into the pricing basis.
And I imagine this means it drives the price up.
Yes. It would.
But
in this instance, it won't necessarily lead to the policy becoming more expensive. We would still look at, for a typical individual life policy, if you're an individual of generally good health, you've got a good immune system, there's a good likelihood that you would recover from the virus, so we would not load you in this instance because of the virus.
And I know it's still pretty early days. I mean, even though coronavirus sort of, started making headlines around December in China, South Africa in particular has only really started giving a real focus to the story about 3 weeks ago. Has that in any way affected the life insurance market, over the past few days or weeks? I mean, are we seeing the impacts in that space yet?
We, as a life insurance company, hasn't seen any abnormal activity arising from it. I think in general it's a good time for people to be reviewing their financial products and their financial planning horizon, the basket of products that they have in their portfolio. We haven't seen individuals scrambling to go and buy the policies, and nor are we advising that people should do it as a result of fear. You should still be buying life insurance as part of longer-term financial planning, and you should be buying it for the right reasons, not because you currently fear the coronavirus.
And I know there's obviously always consideration around things like pandemics and the likes, but I mean, do you very quickly think that the life insurance sector was caught by surprise by this? Because as you said, I mean, the risk is quite low, and that's largely because these kind of instances are few and far between across the years, so to speak.
Because we plan for pandemic and epidemic risks in theory, it doesn't surprise us that they merge. In this instance, it's more interesting to note how it progresses across the world and what the recovery rates are. So we're more interested in the recovery rates and the progression of the disease than necessarily the outbreak of the disease.
I'm going to have to leave it there. Thank you very much for coming through and sharing your insights with us. Hopefully that's empowered you to make the right decisions around your life insurance policy. That, of course, is Marius Botha, who's CEO of Stangen. Do appreciate your time.
Thank you.